Hey, Amy, are you okay? You don't look well.
I don't feel good. I have a really bad headache and my throat hurts.
How long have you felt this way?
Since yesterday morning, I thought it would get better, but it's getting worse.
That doesn't sound good. Have you taken any medicine?
Yes, I took some pain medication, but it didn't help much. I still feel terrible.
I think you should see a doctor. Have you called your doctor's office yet?
No, I haven't. To be honest, I'm nervous about calling. My English isn't perfect, and I don't know what to say.
Don't worry, it's easier than you think. I can help you. Do you have your insurance card?
Yes, I have it. But what do I need to say when I call?
First, you need to tell them you want to make an appointment. Then they'll ask some questions.
What kind of questions?
They'll ask for your name, date of birth, and why you need to see the doctor. It's very simple.
Okay, that doesn't sound too difficult. What else should I prepare?
Have your insurance information ready. They'll need your insurance company name and policy number.
I have all that on my insurance card. Should I call now?
Yes, the sooner you make an appointment, the sooner you'll feel better. Do you want me to stay here while you call?
Yes, please. That would make me feel more comfortable. Can you help me practice first?
Of course. Let's do a role play. I'll pretend to be the receptionist and you call to make an appointment.
That's a great idea. Okay, I'm ready.
Good morning, Dr. Wilson's office. How may I help you?
Hi. I would like to make an appointment, please.
Perfect. That's exactly what you should say. Then they'll ask, are you a new patient or an existing patient?
Oh, I'm a new patient. I just moved here last month.
Good. So you'll say, I'm a new patient. Then they'll ask for your personal information.
Like what?
Your full name, date of birth, phone number, and address. Do you have all that ready?
Yes, I do. What comes next?
They'll ask, what's the reason for your visit? You need to explain your symptoms.
So I should say, I have a headache and a sore throat?
Exactly. You can also say how long you've had these symptoms, like, I've had these symptoms for 2 days.
That's helpful. What if they ask me other questions I don't understand?
Don't be afraid to ask them to repeat or speak more slowly. You can say, I'm sorry, could you repeat that? Or, could you speak more slowly, please?
That's a good tip. I always forget I can ask people to slow down.
It's completely normal. Doctors' offices are used to speaking with people from different countries. They'll be patient with you.
That makes me feel better. What happens after I explain my symptoms?
They'll check the doctor's schedule and offer you some appointment times. They might say, we have an opening tomorrow at 2 p.m. Does that work for you?
And if that time doesn't work for me?
Just say, I'm not available at that time. Do you have anything earlier? Or do you have any morning appointments?
Okay, I understand. What if they only have appointments next week?
If you're really sick, you can ask, do you have any appointments today? It's urgent. They might be able to fit you in for an emergency visit.
Good to know. What else do I need to ask?
Ask about what to bring to your appointment. Usually you need your insurance card, a form of ID, and a list of any medications you're taking.
I'm not taking any medications right now. Is that okay?
Yes, that's fine. Just tell them you're not currently taking any medications.
What about the cost? Should I ask how much it will cost?
Yes, that's a smart question. You can ask, how much will the visit cost? Or, what's the copay for my insurance?
What's a copay?
A copay is the amount you pay at each visit. Your insurance covers the rest. For example, your copay might be $20 or $30.
Oh, I see. That's not too expensive. Okay, I think I'm ready to call now.
Great! Remember to be polite, speak clearly, and don't rush. Take your time.
Okay, I'm going to call now. Wish me luck.
You'll do great. I'm right here if you need help.
I did it. That wasn't so hard.
See? You were great. I'm so proud of you. You sounded very confident.
Thank you for helping me practice. I felt much more prepared because of you.
You're welcome. So, you have an appointment at 3 p.m. today.
Yes, I'm so relieved. I was worried they wouldn't have any appointments available today.
That's lucky. It's only 1 p.m. now, so you have 2 hours. What will you do until then?
Well, the receptionist said I need to arrive 15 minutes early to fill out new patient paperwork.
Right, that's normal for new patients. They'll ask about your medical history, allergies, and current medications.
Medical history, what does that mean?
It's information about your past health problems, surgeries, or serious illnesses. For example, have you ever had any surgeries?
No, I've never had surgery. I've been pretty healthy my whole life.
Perfect. Just write that on the form. They'll also ask about family medical history, like if your parents or siblings have any health conditions.
My dad has high blood pressure, but that's all I know.
That's good information to share. What about allergies? Are you allergic to any medications?
No, I don't think so. I've never had a bad reaction to any medicine.
Great. Make sure to mention that. Now, let's talk about what happens at the doctor's office.
Yes, please. I've never been to a doctor in this country before. What should I expect?
First, you'll check in at the reception desk. Give them your insurance card and ID. They'll make copies and give them back to you.
Okay, that sounds simple.
Then you'll sit in the waiting room until they call your name. They might ask you to fill out forms while you wait.
What happens when they call my name?
A nurse will take you to an examination room. First, they'll check your vital signs, your temperature, blood pressure, and weight.
Will the nurse speak English slowly if I ask?
Absolutely. You can say, "I'm still learning English. Could you please speak slowly?" Most medical staff are very understanding.
That's reassuring. What happens after the nurse?
The nurse will ask about your symptoms and write everything down. Then the doctor will come in to examine you.
What will the doctor do?
The doctor will ask you more questions about how you feel. They might look at your throat, listen to your lungs, and check your ears.
Will it hurt?
No, it doesn't hurt at all. The doctor is just checking to see what's wrong. Be honest about your symptoms and answer all their questions.
What if the doctor uses medical words I don't understand?
Don't be shy. Ask them to explain in simpler terms. You can say, "I don't understand that word. Can you explain it differently?"
Good idea. What happens after the examination?
The doctor will tell you what's wrong and explain the treatment. They might prescribe medication or suggest rest and fluids.
How do I get the medication?
If you need medication, the doctor will give you a prescription. You take it to a pharmacy to get the medicine.
Is the pharmacy inside the doctor's office?
No, usually you go to a separate pharmacy, like CVS or Walgreens. The doctor's office can recommend one nearby.
Okay, I understand. What about paying? Do I pay before or after seeing the doctor?
Usually, you pay the copay when you check in, but some offices let you pay after your appointment.
And if they prescribe medication, I pay for that separately at the pharmacy?
Yes, exactly. Your insurance might cover part of the medication cost, but you'll pay something at the pharmacy too.
This is all very helpful. I feel so much more prepared now.
I'm glad. Do you want me to drive you to the appointment? You don't look very strong right now.
That would be wonderful. I don't feel well enough to drive myself.
No problem. We'll leave at 2:30 p.m. to make sure you arrive on time. Do you need anything before we go?
Maybe some water? My throat is so dry.
Of course. Let me get you some water. And you should rest until it's time to leave.
Thank you, Chris. You're such a good friend. I don't know what I would do without your help.
That's what friends are for. I'm happy to help. I remember how nervous I was at my first doctor's appointment here, too.
Really? You seem so confident now.
Practice makes perfect. After a few visits, it becomes much easier. Soon, you'll be able to make appointments without any worry.
I hope so. At least now I know what to say and what to expect.
Exactly. And remember, if you ever feel sick again, don't wait too long to call the doctor. It's better to get help early.
You're right. I waited too long this time. I'll call sooner next time.
Good. Now rest here on the couch. I'll wake you up when it's time to go.
Thank you so much. I already feel a little better just knowing I have an appointment.
That's good. The doctor will take care of you. Everything will be fine.